Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Is testicular extraction of sperm a dangerous procedure? This is a question a lot of male patients ask us, especially when they present themselves with no sperms, which is also called as azoospermia in a semen analysis report. So let's try to understand what TISA is, how it is performed, and whether it is a dangerous procedure. So we'll have to first go back to understanding what azoospermia is. Azoospermia is the lack of sperms, especially reported when we do a semen analysis examination. During this process, the sample is thoroughly examined, and if there are no sperms present, whether it is 1 or 2 also, if there are no sperms present at all, then the report is given as azoospermia. It could be obstructive or non-obstructive. In both cases, whether it is obstructive or non-obstructive, minimal treatment can be given. In case of non-obstructive, extensive treatment can be given, after which a testicular extraction can be performed whereby sperms are extracted from their place of origin, which is the testis. So let's try to understand how it is performed. It's a very simple procedure in today's days of high technology, where anesthesia is given to the patient and a very thin needle is passed into the testis. The urologist will either look at the epididymis or the testicular area and try to give us either the fluid from the epididymis or the testis, or a small bit of tissue from the epididymis or the testis. Now, the kind of sperms that we get from these areas, which are very close to each other, might differ a little. So basically, if we get into the testicular extraction of sperms, if performed, then it is assumed that better sperms are retrieved. TISA is the testicular extraction of sperm by aspiration from the epididymal area. So this procedure involves just the fluid removal from epididymal area and examined for sperms, and this is used for intracytoplasmic sperm injection or IVF. So there are various methods. There is another one called MISA or microsurgical aspiration of sperms, MISI called as microsurgical extraction of sperm. So these are all the types of procedures, but in today's terms, because of good technology, good instruments, good experienced, skilled urologists present, this procedure is performed very easily. The procedure may be from about 15 minutes to 30 minutes, after which the patient is shifted to the recovery room, where he rests for about a couple of hours, and the patient can then walk out of the recovery room on his own. It is advised not to drive that day because you will be under the influence of anesthesia. So if someone accompanies you, it's very good. You can go back to work from the next day because painkillers are given. There is no external injury because stitches are put if it is a microsurgical extraction. Otherwise, for the other procedures, there is no open suture at all. So it's a very fairly easy procedure. There is no threat to life. It's very easy, in safe hands, experienced hands. There is no threat to life. If you wish to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.